Hi, my name is Maggie Mendez, and today I will be talking about the Unit 7 at Unit 9. Nurse. Nursing grades. Nurses working in a hospital have the following grades. A student nurse, a nurse who is still in training. A staff nurse, a nurse who has completed the training course. Charge nurse, a more experienced nurse who is charged of the responsibility for the work or department. Nurse manager, a nurse who is charged of several wards. Note: the old term sister is still sometimes used the female charge nurse. A female nurse manager may be called matron. Dr. James is a talking to Sister Watkins. Support worker. The clinical support worker who has done a short course and obtained basic qualification under nursing associate, who is usually qualified but assist nurse staff. There may also be ward clerks whose duties include making sure patients' notes and information are up to date and answer the telephones. C. Specializations. Like doctors, nurse can specialize. A midwife has specialized from the beginning by doing a course in midwifery. They maternity, the pregnancy and childbirth. District childbirth. District nurse. Visit patient in their home. Health visit. Also work in community giving advice of the promotions of health and the prevention illness. The nurse role. The nurse role has chart considered in the rest years in the additions to general patients care, checking temperatures, pulse and blood pressure, shaking, dressing, giving injections, and removing sutures. Nurse now do same to often previously refers for our doctors, such as prescribing drugs and ordering laboratory tests. More responsibility for nurse is planned as the following article demonstrates. Nurse carry out surgery in after to cut patients very less. Nurse is a Scotland training to perform in nurse surgery have entered the operation test for the first time in an effort to cut patients very time. Fire nurse who have patients a new course at Glasgow Canadian University are now qualified to carry out such procedures and the remote a small lesions begin most and cease. The verb perform carry out are used with a types the produce they are often in the passive form. Perform an examination, carry out an operation, perform a procedure, carry out an experiment, perform a test, carry out a biopsy. The produce was performed and carried out by nurse. Em, las enfermeras. Las enfermeras que trabajan en el hospital tienen los siguientes grados. Estudiante de enfermería es un estudiante que todavía está en formación. Equipo de enfermera, una enfermera que ha completado el curso de formación. Enfermera a cargo, una enfermera más experimentada que está a cargo de o es responsable de un barrio o departamento. Gerente de enfermería. Esta enfermera es la que está a cargo de varias salas. Nota, el antiguo término hermana también se usa a veces para referirse a una enfermera a cargo. Una jefa de enfermedad puede llamarse matrona. El doctor James está hablando con la hermana Waltz. B. Los trabajadores de apoyo. El trabajador de apoyo clínico que ha realizado un curso corto y obtenido calificaciones básicas y el auxiliar de enfermería que generalmente no está calificado ayudan al personal de enfermería. También pueden ser empleados de sala cuyas funciones incluyen asegurarse de que las notas y la formación de los pacientes estén actualizadas y contestar el teléfono. Especialización. Al igual que los médicos, las enfermeras pueden especializarse en una matrona. Se ha especializado desde el inicio haciendo un curso de partería, el manejo del embarazo y el parto. Las enfermeras de distrito visitan a las pacientes en sus hogares. Los visitadores de salud también trabajan en la comunidad, dando consejos sobre la promoción y la salud de prevención de enfermedades. El papel de enfermera. El papel de enfermera ha cambiado considerablemente los últimos años, además de la atención general del paciente, controlar la temperatura, el uso y la presión arterial, cambiar vendajes, aplicar inyecciones y quitar suturas. Las enfermeras ahora hacen algunas cosas que antes estaban reservadas para los médicos, para recetar medicamentos y solicitar pruebas de laboratorio. Está prevista una mayor responsabilidad de las enfermeras, como demuestra el siguiente artículo. Enfermeros realizan quirófano para reducir lista de pacientes. Enfermeras escocesas capacitadas para realizar cirugías menores ingresaron al quirófano por primera vez en un esfuerzo para reducir los tiempos de espera de los pacientes. 5 enfermeras que aprobaron un nuevo curso de la Universidad de Queensland Canadian ahora están calificadas para llevar a cabo procedimientos tales como la extirpación de pequeñas lesiones, lunares benignos y quistes. Los verbos realizar y realizan llevan a cabo todo tipo de procedimientos. A menudo se utilizan en forma pasiva. Realizar o llevar a cabo. Realizar una examinación, llevar a cabo una examinación, realizar una operación, llevar a cabo una operación, realizar un procedimiento, llevar a cabo un procedimiento, realizar un experimento, llevar a cabo un experimento, realizar una prueba, llevar a cabo una prueba, realizar una biopsia, llevar a cabo una biopsia. El procedimiento fue realizado o llevado a cabo por una enfermera. Exercise 7.1. Complete the sentence. Look at A, B, and C opposite to help you. Someone who specializes in delivering babies is a midwife. Someone who is specialized to assist nurse in clinical support worker. Someone who is not qualified but are able to assist nursing in nursing is a nursing usually. A nurse who are qualified is a staff nurse. A nurse who is specialized in the health promotion is a health visitor. A nurse who looks after a ward is a charge nurse. A nurse who works in the community is a district nurse. Someone who answers the work telephone is a ward clerk. Make word combination using word or phrase from each box. Look at the opposite to help. Carry out, change, check, give, remove, sutures, produce, injection, describe, detect, remove, suture, carry out, produce, change, describe, this addressing, Give an injection. Check the temperature. 7.3. Complete the sentence with the correct grammatical form of perform. And stop brain scan in painless and easy to perform. Biopsy of the pancreas was performed last March. If the patient's condition deteriorates, a laparotomy should to be performed. If a diagnosis of meningitis is suspected, the lumbar puncture must be performed. Last year, we performed a randomized double-blind low growth study. 7.4. Complete the sentence with the correct grammatical from carry out. Are now intent to carry out a large study. Unfortunately, few properly controlled trials have been carried out so far. A number of studies have been carried out recently to look at these questions. A right hemicolectomy have been carried out and the patient made a full recovery. These procedures can be carried out in the emergency department. Allied health professionals. Community health. Health of the community depends on a large number of people after that medical practitioners of nurse. These can be grouped under the heading of allied health professionals. They include the following: physiotherapists, physios, help people to move the getting them to exercise or being training their body with hair or masses, treatment by manipulation muscles and joints with the hands. Occupational therapists (OTC) help people with a disability to perform tasks at home, at work. A disability is a physical or mental condition that makes it difficult to live normally, for example, blindness or deafness. Social workers help people to solve their social problems, for example, poor housing, unemployment, or family problems. Chiropodists, also known as podiatrics, treat conditions affecting the feet. Technicians. There are numerous technician people who work with scientific equipment such as radiographers who are known as X-ray technicians, ambulance technicians work in the emergency medicine service. Ambulance technician with more advanced qualification is called paramedic. Eh, Prosthetists and orthosists. Prostheses and orthoses provide care for anyone who needs the artificial limb, a prosthesis, or a device to support the control part of the body and arthrosis. They also advise on rehabilitation, helping patients return to normal life and work after treatment. Prosthetics promote artificial replacements for patients who have had amputation or were born without limbs. Orthoses provide a range of spring and the other device to aid movement, correct deformity from the abnormal development of part of the body, for example, club foot, tactileness, and relief pain, prosthesis and splints. Profesionales de la salud aislados. La salud de la comunidad. La salud de la comunidad depende de un gran número de personas. Además, de médicos y enfermeras. Estos se pueden agrupar bajo el título de profesionales de salud aislados. Incluyen los siguientes: los fisioterapeutas, que ayudan a las personas a moverse, haciéndolas hacer ejercicios o tratando su cuerpo con calor o masajes, mediante la manipulación de músculos y articulaciones con las manos. Los terapeutas ocupacionales, o TS, en su sigla en inglés, ayudan a las personas con discapacidad a realizar tareas en el hogar y en el trabajo. Una discapacidad es una condición física o mental que dificulta vivir normalmente, por ejemplo, la ceguera o la sordera. Los trabajadores sociales ayudan a las personas a resolver sus problemas sociales, por ejemplo, viviendas deficientes, desempleo, problemas familiares. Los podólogos, también conocidos como eh, podólogos, tratan afecciones que afectan a las pies. Técnicos. Hay numerosos técnicos, personas que trabajan en equipos científicos como los radiógrafos, se conocen como técnicos de rayos X. Los técnicos de ambulancias trabajan en el servicio de medicina de urgencias. Un técnico de ambulancia, unas calificaciones más avanzadas, y se llama paramédico. Protésticos y ortestistas. Los prostéticos y los ortepistas brindan atención a cualquier persona que necesite un miembro artificial, o hágase llamar una prótesis, o un dispositivo para sostener o controlar una parte del cuerpo, o una ortesis. Ellos también asesoran sobre la rehabilitación, ayudar a los pacientes a volver a la vida normal y trabajar después del tratamiento. Los protestistas proporcionan reemplazos artificiales para pacientes que han tenido la amputación que nacieron en una extremidad. Los ortopistas promocionan la variedad de férulas y los dispositivos para facilitar el movimiento, corregir la deformidad de un desarrollo anormal de la parte del cuerpo, por ejemplo, el pie sambo, tapiles, y aliviar el dolor. Exercise 8.1. Make word combination using a word from each box. Look at A, B, C, D and opposite to help you. Ambulance, artificial fluid, contact hut, intraocular, occupational, social, food, lens, limb worker, pursuit, technician, professional, therapist. Ambulance technician, artificial limb, do food, contact lens, health professional, interlocutor, pursuit, social worker, occupational therapist. With allied health professional could best help the following people. Look at A, B, C, D, and D opposite to help. A young unmarried woman who has just had a baby, social work. A woman who is having difficulty using her right arm, following a fat physiotherapist. Someone who needs glasses, option. An elderly woman has had a bellow knee amputation prosthesis. A man whose wife has Alzheimer's disease, social worker. A man with foot affection in the foot, podiatrics. Complete the text. Look at A and B and C opposite to help you. A prosthesis works my version of the age as a member for clinical team based at a large hospital. The patients may need prostheses and the resultant of an accident or amputation following a disease such as diabetes. Alternatively, they may have been born without limb orthosis where allowance doctors, nurses, physiotherapists, and occupational therapists to give the people under their care the best possible rehabilitation. Their main aim in the enable the person to lead a normal life, work and leisure. Arthrosis often work in a clinical as a part of a outpatient service and also visit other centers to provide a service to people with special needs. They deal with people of the age, for instance, children who have cerebral palsy may require arthrosis to help then walk, and many older people need special shoes to carry the former. Is the mesh any part of the human skeleton might require some form of orthosis. The orthosis may be needed the repositions the body or to relieve pain. Hospital. Introduction to hospital. Um, Jordi Pins is a 40-year medical student from Barcelona. He has come to Britain on an elective attachment to Royal Infirmary Edinburgh. Dr. Byron is introducing him to the hospital. Dr. Byron, the Royal Infirmary, is the name of the university hospital for Edinburgh University. It is a general hospital dealing with all types of patients and illness except pediatrics. We have a specialty hospital for that in another part of Edinburgh, the Hospital of Sick Children. You can see some of the departments in our hospital on the sign. Of course, there are many others. For example, the intensive care unit UCU and the surgical high dependence unit HDU. Jordi was thus operation made. Dr. Byron, outpatients are the people who come to hospital to attend a clinical or they have test or treatment and then return home on the same days. Inpatients stay in the hospital for one or more days. The rooms where they stay are called wards. In a patient's treatment requires only one day, such as simple operations. They can be admitted to be the surgery unit. Welcome to the Royal Infirmary. Such attends car the visitor staff. The Simpsons Center for Production Health. Gynecology emergency. Maternity emergency. Pneumatology emergency. Operations departments, always the surgery unit, endoscopy, X-ray department, combinate and assessments. Outpatients. Dr. Byron, the Accident and Emergency Department, ANE, also called quality, is where patients who are acutely ill with a sudden serious condition come for treatment. Outpatients who have an appointment to see a specialist to go a clinic in one patient departments. They have usually been referred to hospital by their GP, who writes a referral letter to the consult explaining the patient's problem. In inpatients, Dr. Byron, the inpatient in a hospital are admitted in one of three main ways. They may be seen on the obtains clinics and admitted from thereof there is a lot of demand of treatment they need is a is the case of hip replacement. There are put on waiting lists for admissions alternative. Their GP may arrange the admission by telephones because they are acutely ill. For example, with suspect myocardial infarctions of they are seen the A&E department where the doctor on duty working at the time arrange the admissions that would happen in the case of a patient with a fractured neck or femur. For example, large hospital may have an asthma unit where patients can be admitted temporarily with their condition is assessed. Jordi assess. Jordi, Dr. Berron, yes, decisions are made about the condition and what needs to be done to help them. After treatment is complete, the person described back to GP care. Hospitales. Introducción a un hospital. Jordi Pons es un estudiante de cuarto curso de medicina de Barcelona. He venido a Gran Bretaña a un archivo de adjunto de Royal Informatics de Edimburgo. El doctor Burron lo está presentando al hospital. El doctor Barron de Royal Informatics es el nombre del hospital universitario de la Universidad de Edimburgo. Es un hospital general que atiende a todo tipo de pacientes y enfermedades, excepto pediatría. Tenemos un hospital especializado para eso en otra parte de Edimburgo. El Hospital for Chick Children. Puede ver algunos de los departamentos de nuestro hospital en el letrero, por supuesto. Hay muchos otros, por ejemplo, la unidad de cuidados intensivos, conocida como UCI, y la unidad de ATRA, dependencia quirúrgica, como UDU. Doctor Barron, los pacientes ambulatorios son las personas que vienen al hospital para salir a una clínica para someterse a pruebas de tratamientos, luego regresan a la casa el mismo día. Los pacientes internados permanecen en el hospital durante uno o más días. Las habitaciones donde se hospedan se llaman salas y el tratamiento de un paciente requiere solo un día. Como una operación simple puede ser ingresado en la unidad de cirugía de día. Bienvenidos a la Enfermería Real. Entrada sur. El Centro Simpson, la salud reproductiva, ginecología, maternidad, neonatología, departamentos ambulatorios, unidad de cirugía de día y endoscopia, departamento de rayos X y la ambulación de evaluación de cabina. Pacientes ambulatorios. El doctor Barron, el Departamento de Accidentes y Emergencias, también llamado casualidad, es donde los pacientes están gravemente enfermos con una afección repentina y grave. Acuden para la evaluación y tratamiento los pacientes ambulatorios que tienen una cita para ver a un especialista, van a una clínica de los departamentos de pacientes externos o PD. Por lo general ha sido remitidos el hospital por sus médicos de cabecera, quien escribe una carta de referencia al consultor explicando el problema del paciente. Pacientes hospitalizados. Los pacientes internados en el hospital son admitidos de una de tres formas principales. Pueden ser atendidos en alguna de de las consultas externas, ingresados desde allí, y si hay mucha demanda del tratamiento que necesitan, como en el caso de la prótesis de cadera, se le pone en lista de espera para su ingreso. Alternativamente, su médico de cabecera puede organizar la admisión por teléfono porque están gravemente enfermos, por ejemplo, con sospecha de infarto de miocardio, o se les atiende en urgencias, donde el médico de turno que trabaja en ese momento expone el ingreso. Esto ocurriría en el caso de un paciente con fractura de cuello de fémur. Por ejemplo, los hospitales más grandes pueden tener una unidad de evolución donde los pacientes pueden ser admitidos y temporalmente mientras se evalúa la condición. eh, Jordi, evaluado. Sí, se toman decisiones sobre la condición y lo que debe hacer para ayudarlos. Una vez que se completa el tratamiento, el paciente es dado de alta de nuevo al cuidado del médico de cabecera. Exercise 9.1. Complete the table with word fronts A and B and C opposite do a stress mark in the front of a stress symbol. In each word, the first has been done for you. Bear, admit, assess, describe, refer, and treat. Admit, admissions, assess, assessment, discharge, operation, refer, referral, treatment. Make word combination using a word's edge box. Look at C opposite to help you. Accurately assessment on referral grading unit letter list duty and ill. Actually, accurately ill assess unit on duty waiting list referral letter. Which hospital departments would be most appropriate for the following pensions? Look at A, B, and C opposite to help. A woman in diabetes coma in tests carry out ECU. A person who's had a radical prostatectomy, high dependence unit. A patient who is to have a skin lesion removed, their surgical unit. A man unit a foreign body in his eyes, accident and emergency. A woman with a treatment abortion gynecology emergency. Complete the extract from an information letter for patients. Look at A and B and C opposite to help. Information for all patients. When you arrive at the hospital, please tell the receptionist who will welcome you, check your details, and direct to the waiting area. The length of your visit will depend on the treatment you're going to have. You may need to have some tests, such as a X-ray, which could mean going to another department or you may be referred to other professionals such as physiotherapists or dietitians. You may need to visit the clinic if staff at the clinic want to see you again. Another appointment will be arranged for you. If you need to be admitted to hospital for more treatment, either as inpatients or for day surgery, you will be told when this is likely to happen. If you do not need further treatment, you will discharge to your GPS card.